basic principles of fluid therapy in sheep and goat. One of the part of the fluid therapy is the blood transfusion. So having a 7 blood groups and goat is having a 5 blood groups, but there is no need to have a cross matching before doing the first transfusion in a ruminants. So you can very well appreciate blood transfusion by collection from the donors and to transfusion to recipients. When you will go for blood transfusion, any bleeding disorders or any anemia due to hematopoietic diseases, after the treatment, animal is not recovering properly, still the packed cell volume, the blood pressure below 15% of packed cell volume, or hemoglobin percentage of 5% level, 5%, 5 gram per deciliter level, and RBC level is below anticipated level. So we need to replace the RBCs by the way improving the oxygen carrying capacity of the blood. For that, we need to go for blood transfusion. You can very well collect 10 to 15 ml of blood from the donor, healthy donor. Healthy donors don't have any pregnancy, not having any diseases, and ecto parasites. And that donor should be selected. You can collect from the jugular vein. You can use the ACD bag, adenine, citrate, and dextrose bags are available. That is for meant for the human beings. Same bag, 350 ml you can collect. So for either every 50 ml of blood collection, we need to have 7 ml of anticoagulant. So 49 ml of anticoagulants present in the blood bag available in the market that is meant for 350 ml. I'm just giving the something. Suppose if you want to take only 100 ml, you need to take only 14 ml of the anticoagulant and you can collect it. Many things you can discard it. Then we get a weighing balance. Put the weight while collection from jugular vein that has to be kept in the weighing balance. If you are reaching 100 grams, you can very well disconnect and give to the recipients. Before going for the recipients blood transfusion, you have to give antihistamics 10 to 15 ml ahead of that to avoid the transfusion reactions. So the initial transfusion is done at 0.1 ml per kg body weight. That means drop by drop you have to administer. And then if it is not having any transfusion reactions like hiccup, hypothermia, any salivation, coughing, fever, you can very well have particle eruptions. You can very well start the fast rate of administration 20 ml per kg per hour after 10 minutes of starting the blood transfusion. So the blood transfusion is another one more life-saving procedure apart from the fluid therapy. The blood transfusion and fluid therapies are the two important procedures we can very well appreciate to save the life of animal. So we need to address those things in needy cases. So the anemic animal, collection of blood and administration of the blood to the sheep and administration to the kid. I wanted to just to tell that you can just go for some transfusion boldly in case of any needy cases. And you have to address the primary cause also, maybe ectoparasites, maybe lice infection, flea infestations, and ticks in case of kids. And if you are giving 10 to 15 ml of blood in 1 or 2 kg animals, kids, very well you can save the animal. You can directly collect it from the jugular vein with a syringe after adding the anticoagulant. And apart, if you are not having the blood bags, you can also use the heparin sodium citrate. According to the need, you can collect and give.